So let's talk about some different administration routes that are available to peptides. The first is intramuscular. This is going to give you the fastest absorption and the highest peak concentration due to the high vascularity present in the muscle tissue, but it's also going to give you a very quick clearance of the peptide. Uh, and keeping in mind that so many peptides require daily administration, it's not ideal for that. No one was taking IM shot every day. So then we have subcutaneous administration. This is the most common systemic delivery method for peptides. This is to give you a bit slower administration than intramuscular injections, but it's going to give you a very stable exposure and it's more conducive to daily administration. Then you have intranasal delivery. This is where the peptide could potentially be delivered and absorbed to the nasal mucosa. And this is a very useful potential access point for peptides where the desired effect is on the central nervous system, because that can be a bit of a gateway to that region if it can be absorbed through the nasal mucosa. And then there's oral administration. This can be very limited by gastrointestinal degradation, by the enzymes and harsh environment of the gut, but is achievable with some peptides that might have sufficient stability or specialized dosage formulations that enable this. And it's also very useful with the desired effect is actually in the GI tract and not systemic absorption in the body, but you're actually trying to produce an effect and target the GI tract itself. And then there's sublingual and buccal administration. This can potentially avoid first pass metabolism and some of the enzyme degradation and harsh environment of the gut that might affect the bioavailability of the peptide. But this can be very limited by the peptide size and membrane permeability properties. So the absorption rate here is going to vary peptide to peptide somewhat.